Epione Pain Management Center. ఇక్కడ మీ నొప్పులు శాశ్వతం కావు.
So do you want to know what are the causes of chronic neck pain? The most common being a cervical disc prolapse, which is also called as cervical spondylitis in a very layman term. Now, what is this cervical spondylitis? A small disc which is present between the two bones of the cervical spine herniates or comes out and it starts compressing one of the nerve which goes to your hand. Now, if it is compressing the upper levels of the spine, you may have pain only in the neck. And if it is compressing the lower levels, you may have pain in the shoulders or into the hands, which may radiate up to your fingers, maybe on one side or on both sides. It may be associated with tingling, numbness, burning sensation, sometimes also itching, and sometimes there may be weakness also. When I tell weakness, when you hold a glass of water or you hold a mobile phone, it tends to fall. Now, if weakness is there, that is a red flag, and you need to see a doctor on a medical emergency basis. Now, cervical spondylitis is a very common thing. Most of the software employees and most of the people who work on systems or lift heavy weight are prone for getting this cervical spondylitis. The other causes could be because of the muscles which support your spine and the head. The other causes would be facet joints. The other causes could be because of shoulder pathology. A lot of time we see that shoulder pain can also cause neck pain, and sometimes any cause in the brain can also cause you the cervical spine pain. Now, what to do and what not to do? So, if your pain is less than 3 months, try doing certain lifestyle modifications, posture corrections, changing your mattress, using a pillow which is comfortable to you. But if it is chronic of more than 3 months, then make sure that you visit the pain physician so that they can identify what is the cause of pain. Identifying the cause of pain is very, very important, because again, the treatment will change accordingly. Like I said, since it is very common in software and those who lift heavy weights, the first thing is to make sure that you avoid any kind of weightlifting for some time. Weightlifting could be like a vegetable bag or a bucket of water or a suitcase while traveling, and most commonly for housewives, lifting heavy cookers, pressure cookers, because we ignore the weight of pressure cooker, but that contributes a huge amount of weight, putting a lot of pressure on your spine. Now, if you want to watch any kind of gadgets or want to have your screen time, make sure you do not flex your neck down, and it should always be at your level of your eyes. If you are working on desktop in your office, make arrangements where your desktop is at level of height, so that you don't have to flex your knee like this and your eyes are in direct contact with the laptop or the screen you are working with. And there will be certain exercises, certain rehab exercises to strengthen your neck muscles and shoulder muscles. And if again it does not subside, then you better go for a MRI as prescribed by your doctor, so that we identify how much is the problem inside and then we can treat it. There are lots of modalities where a simple injection technique like a radiofrequency ablation or a platelet-rich plasma therapy or minimally invasive procedures will give you 100% permanent relief. Most of the time, if you go see a doctor, they may tell you to undergo surgery. Please do not undergo surgery if you do not have red flags. What are the red flags? A continuous pain of a score more than 10 by 10, any kind of fever, weakness in the hand, and loss of your urine and motion control. These 4 are the red flags. Only if you have red flags, choose to go for surgery. If you do not have red flags, getting a cervical spine surgery can be life-threatening. And finally, choose to go to a place which has treated such patients on an everyday basis, and Epione Pain Management Center is one of the best pain management center, not only in India but in among so many countries of South Asia. We have treated more than 50,000 patients of such conditions in a scientific protocol manner, using all FDA approved machines with a state-of-art facility, giving the best result to our patients.